Hello, I'm your host, Dr. Johnson, Sonia Johnson. Okay, so we're waiting on some people to join us. As I always say, if you want to share this screen, just press the button at the bottom of the screen. Sharing is caring. And if you have a friend you want to hear this message, by all means, tag them. Okay, so I hope you had a wonderful day today, middle of the week. And so you have a couple more days to go. Anyways, let's get started here. I'm your host, Dr. Sonia Johnson. Welcome to the Gorgeous Glow Skin Show. So I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about procedures again, and it's going to be on IPL. It is Pulse Light Therapy. So IPL, the acronym, it is used mainly to help with age spots, or another word for it called solar lentigos. And what I like about it is, once you treat the area, everything turns a shade darker. Even lesions that you didn't know was there will turn a shade darker. And about 2 weeks later, it exfoliates off on its own. So as you're washing your face, it just flakes off like powder. Does not leave any residue of redness behind or anything else. So it really is a good way to even out that skin tone by getting rid of those age spots. Now, the question is, you ask me, why in the world are you talking about age spots? Well, age spots can occur on anyone, all ethnic groups. And it's due to, of course, years of sun, as well as hereditary causes. And another word for them are liver spots. But they're the brown spots on your face that looks like somebody colored your face with some brown crayon of some sort. But they're benign, nothing to worry about. But what I like about IPL is when it treats the area, you treat the entire face, it does it evenly. And you may have some age spots that need to be treated more than once or with the higher joule or energy rather, and you can do that. But after one treatment, you'll see a big difference. A lot of lasers may have different protocols. I know for the one we use through Katera, they recommend 4 treatments, so once a month for 4 treatments. And after that, even after the first treatment, you're going to see at least 40 to 50% difference. But as you keep getting it performed, it will not only get rid of, like I said, the ones that you really can't appreciate, but also make sure that they don't come back fast. So it really does a good job of clearing out those brown spots. And once you're done, you should have the outcome you're trying to achieve. Now, another way I use IPL is for melasma. And what it does, it helps break up the brown pigment. But the problem is you cannot use the same jewels that you use for the solar lentigos or the age spots. You have to really dial back on the energy. And yes, I do use this on ethnic skin types. Well, as you know, we can measure skin types from level 1 to level 6. So I would be considered a grade 6, or Fitzpatrick 6. And a 1 is a blonde hair, blue eyes, Caucasian. And so in between that, you have your various different Fitzpatrick stages that we as doctors will grade someone on their skin type. So we'll know exactly what type of products, procedures that we can use on their skin. So for IPL is normally indicated for skin types 1, 2, 3. However, dial it down and you're trying to take care of melasma, you can treat it on other skin types too. And you got to make sure you do not burn the person, as well as you want to make sure once you're done, you really cool them down. So IPL is really hot, but you want to make sure after you treat them immediately, get ice, cool it down, cool the area down. And so it's going to help exfoliate. In this case, what we call break up that dyspigmentation. So therefore, the bleaching creams or whatever modalities you're using, such as chemical peels, will work better. But so this is another way we do use IPL to help with that discoloration, to help even out the skin tone. So there's another option for you. So for people who do have some age spots, melasma, The discoloration, that's another modality that's not commonly used, and you want to make sure the person that you go see is a professional and have worked with this with various skin types, various Fitzpatrick types from 1 to 6. They know what they're doing. So just give you a little tidbit, something else you can use. And of course, after treatment, you need some type of product. And I like to use my Ultra Hydrator. So Gorgeous RX has a really neat product. It's a 2% hyaluronic acid. And like I stated in previous videos, hyaluronic acid is normally produced in our body, but as we get wiser, our body doesn't make as much hyaluronic acid. So therefore it leads to more wrinkles and a dry appearing skin. But as you know, you can purchase this product at various doctor's offices, and you can find it in some products over the counter, but usually the concentration is not as high. So just keep that in mind. So our Ultra Hydrator is a serum, and after IPL, we just put it on, your body readily absorbs it, and it gives the body that hydration that it really needs. And so this is, again, another option for you to use to take care of your skin. So if you have any questions, please just put it in the comment section. I'll definitely answer them. Otherwise, thank you again for joining me on the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I help women who want to have even and clear skin tone with increased confidence. If that's you, again, you're at the right place. Listen for my lecture for tomorrow. And again, if you want to have try different products that will be very effective for your face, help you achieve the goals you want to achieve, such as anti-aging or acne treatments, as well as try to maintain what you already have. Products that do not have a scent, products that do last a long time, such as up to 3 months, then you want to go to gorgeous-skin-now.com. Thank you again, and you take care.